is Stephanie Napper, and I'll be doing the teaching video on urine and bowel elimination. And I'm going to start off with showing you the bedside commode. So this will be beside your patient's bed if they can't make it to the toilet or are struggling with squatting down or the sitting and standing motion. This makes it a little bit easier. And then we've got the bed urinal, or bedpan, sorry, which is used if they're bedridden, especially in cases like for this instance, this is a fracture bedpan. So if your patients have fractured their hips or lower extremities and are bedridden, you'll want to keep them flat, and you want to put them on their side and roll them over on top of this with this end, this end pointed to your feet and this end pointed towards your head, and provide them privacy. Let them do their thing and come back and clean them up. But I forgot to mention, you'll want to put this underneath of the bedpan just to prevent from anything spilling out onto your sheets and getting those dirty. And you'll want to use that for when you're administering an enema as well, just in case anything leaks out. And let's see, we've got the urinal. For men, obviously can't use the bedpan for urine, so we've got this, which the cap comes off pretty easily. And if they're able to stand up beside the bed with or without your help, they can use this. It also measures how much you put in there if you're recording intake and output. And if not, if they have trouble standing or they're at a fall risk, you'll want them to use it in bed, in which they'll need your help for that as well. And then we've got an ostomy bag, which we've got a little clip here at the bottom. In order to empty the ostomy bag, you'll take the clip off. You'll be wearing gloves for this, and you can use a bedpan or empty it in the toilet, or if you're measuring intake and output, maybe put it in a container that you can use to measure, like the urinal. And using your gloves, you would empty this out, make sure you got all the feces out, and then you can use a solution to pour in there and kind of swish it around and clean it out pretty good. And then you would clasp it back up. You want to do this when it's about 2/3 full, but you want to actually change the bedpan or the ostomy bag every, say, 3 to 7 days, so you can check the skin and everything, because the adhesive sticks to the skin and can cause irritation, and yeast gets under there as well. So to peel it off, you do it pretty slowly, but there's also solutions you can use to kind of loosen up that adhesive to get it off pretty easily, so you don't hurt your patient anymore, because sometimes their skin's already pretty sensitive. And then lastly, we've got the enemas. So we've got this Fleet enema you can get in stores, which is about 4 to 5 ounces. You would put your patient in Sims position, so on their left side with their right knee flexed. Take this cap off, it's lubricated underneath, the prepackaged one is, and then insert it into the rectum all the way up to this point, and then squeeze the bottle and get all the liquid in there, and have them wait for 1 to 5 minutes so it can get up there and expel the feces. And if you want to really clean out your colon, get more liquid up there, there's this bigger enema right here that holds 1,500 milliliters. And so you would hang it up and pour a solution of warm water and Castile soap concentrate. This is for the soap side enema. And then you would kind of administer it the same idea. You want a lubricant right here, and then it would go in about 3 inches, and then you've got this clasp right here to start or stop the flow from going. So those are the enemas, and for all of these, you want to make sure you're using good hand hygiene, washing your hands, using gloves, and providing privacy and perennial care to your patients. So that's about it. Thanks.